Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. It is that time of year again. Someone starts sniffling at home or in the office, and guess what? Before you know it, flu season is in full swing. And so tonight we are joined by Phyllis Tedeschi. She's a nurse practitioner at Health Express, which is part of South Shore Health. Phyllis is here with us tonight because she's going to talk about proactive prevention of the flu vaccine, severe flu symptoms, what people can expect, and all the ways that we can help fight against the flu this season. So Phyllis, I want to say welcome. Thank you so much for joining us tonight.
Well, thanks for having me.
Awesome. Thank you so much. We are just on the cusp, or you're starting to see it. You actually said it today. What type of flu season do you think we can expect? I know it's unpredictable, but what are you hearing?
It is unpredictable. However, it does seem each year it gets a little bit more aggressive. We seem to see a lot of patients that come in with a lot of the flu symptoms, and some do test positive. Not everybody does test positive, but I sometimes think you feel just as sick when you don't test positive as when you do. So there's a lot of it out there.
Gotcha. And, this flu activity, it starts, again, unpredictable, but there's a typical season for it, right? And typically, what are those months and how long does it last?
Typically, the flu likes to grow in the cold, dry months, and that tends to be October through February, March type season when it's very cold and it's very dry.
Okay. And why is it that because the dry season brings it? Is there a reason we see more of it in the winter than summer?
Well, I think that we're more confined inside in the winter, and so it's easier to pass it from person to person when we're all in these confined areas versus in the summer everybody tends to be outside, or you have your windows open and it allows to clear out the air a little bit.
Awesome. So let's just get to the basics of flu. How does someone actually get the flu?
So the biggest way to get the flu from one person to another is when you cough or sneeze. The flu goes through the air with the droplets. So anytime someone coughs or sneezes, if they're not covering their mouth or turning their head away from somebody else, all those little droplets are going up in the air and you're breathing them in. And the other big thing is hand washing. Hand washing is a huge thing. People just don't wash their hands enough.
Gotcha. And preventative measures as far as hand washing, should they be, everyone sort of says wash your hands through the ABC, sing the ABCs or something like that. Is that, and how long should people be doing that for?
Well, you don't want to just go into the water and just do this.
Yeah.
That's not going to do anything.
Right.
I mean, you have to give a good wash. I think we were taught in nursing school way back in the day, it was to sing happy birthday. And so you just, sang happy birthday and washed your hands and kept them moving and, made sure you got all areas of the hand, and that was enough time.
Okay. Let's talk a little bit about flu symptoms. What can people expect when they have the flu? It's very different from other types of conditions like the cold, right?
So typically the flu comes with high fevers, the body aches, the general body aches, the fatigue, just feeling like you ache from head to toe. Tired. People get very tired with the flu. They can have a non-productive cough. Their fevers can, spike up to 101, 102, sometimes up as high as 104. You don't typically get those symptoms when you have just the everyday common cold. You might feel lousy and you might feel like you have them. But most people with a common cold do not have symptoms of, high fevers, and they don't have that intense fatigue where you just feel like you no appetite. You just feel like you can't get up and get going. You just want to sleep all day.
Okay. We do have a question from John, and he asks, can you still get the flu after you get the flu shot?
There's always an outlier in no matter what preventative measure you do on any type of illness or anything in life. There's always the chance that you can get it, but it does decrease your risk of getting the flu.
Mm-hmm. Okay. Flu symptoms, getting back to that, you talked about fatigue and aches and cough and sore throat, but when should someone really be concerned? When would it be considered severe that you should get treatment?
If your fevers are very high, if you're dizzy, if you feel like you're having difficulty breathing, shortness of breath, chest tightness from, the difficulty breathing, that type of thing, you should be seeing some type of doctor. Whether you call your primary care, you come to an urgent care, or you go to the emergency room, you need to be seen and evaluated for those type of symptoms.
Okay. And typically, again, how long does flu last once somebody has it?
It typically can last 5 to 7 days. There's always some, again, that will last a little bit longer, but for the most part, it's 5 to 7 days.
And during that time, are you considered contagious, or is it just early on the onset, or later on, or through the whole stretch you're contagious?
I think you're pretty contagious through the whole stretch until your fevers have stopped and until you're not sneezing and coughing. Remember, you're passing it by sneezing and coughing. Mm-hmm. So every time you sneeze and cough, you're passing that flu, droplets into the air. So you are contagious until your fevers are gone. And that's one of the big things that we try and explain to people. You need to stay home and do not go to the supermarket and do not go to work and do not. You need to stay home until your symptoms are resolved so that we do not pass it on to everybody.
Okay. We have a question from Lindsay, and she wants to know, is there anything that I shouldn't eat when I have the flu?
No, Lindsay, you can eat pretty much anything you want. The problem's going to be you're not going to feel like eating much. So we always kind of encourage you to drink as many fluids as you can and just eat light meals. There's no right or wrong to what you eat. The fluids are the big thing, but typically you don't feel like eating.
Okay. Can the flu eventually, if left untreated for a while, lead to other types of conditions, like a bronchitis or pneumonia, that type of thing?
So those are the ones that we do worry about, is if you get the flu, one of the biggest complications, or the biggest complication, is pneumonia. So we always encourage people, again, that comes along with the shortness of breath, the difficulty breathing, the tightness that you might get in your chest from coughing. Those would be concerns for an x-ray and making sure that you have not developed a pneumonia from the flu.
Okay. I'm here with Phyllis Tedeschi. She's a nurse practitioner with Health Express, part of South Shore Health. We are talking about the flu tonight. We are encouraging our viewers at home to send in any of their questions regarding flu, perhaps the flu shot, just treatment, prevention, and Phyllis is going to do her best to answer those questions. We are going to continue to talk about severe symptoms. Where can someone go? I know we'll probably talk about this several times, but where can someone go if they're like, I'm concerned? Primary care, ED, where should they go?
Typically, people will come to the urgent care centers because we have the ability to test people right on site for the flu. And we get their results pretty quickly. I think that test is about a 15-minute wait period after we do the test on them in the urgent care center. It makes a little bit more sense to go to an urgent care center versus an emergency room for a couple of reasons. One is your wait time is minimal at an urgent care center. But the other part of that is if you actually do have the flu, your immune system is a little bit down anyway, and now you're putting yourself in an emergency room where there's lots of other illnesses, and you're exposing yourself to that, and you're exposing everybody there to the flu symptoms.
Interesting, yeah, that makes a very good point. Ronnie says he just recovered. So how prevalent is the flu right now for him?
Well, his immune system is probably down still a little bit. It takes a little bit to get back to baseline from where you started, and it's with any illness, even the common cold, you get sick, your immune system's down a little bit. So you've got to, again, it's just running good hand washing and getting good sleep, eating well, make sure you get good vitamins, healthy foods, and all those things are going to help build your immune system back up.
Let's talk a little bit about antiviral medications. I mean, if someone does have the flu, they're just not able to kick it. What types of things can you help them to get over that hump?
So we can prescribe Tamiflu, which is the antiviral medication that we do use for the flu, but there are some side effects to Tamiflu, and I like to kind of make people aware of those side effects because a lot of times Tamiflu comes with nausea, vomiting, and diarrhea. And what I say many times is you already feel not so good. Do you want to add nausea, vomiting, diarrhea to that? Mm-hmm. But the other part of that is there's a very short window. You have to start the antiviral within 72 hours of the onset of symptoms.
Okay.
And My understanding and the research that I had read on this was that the antiviral reduces the flu by 12 hours.
Okay.
So it doesn't always make you feel, it's not going to get rid of it. It reduces the symptoms. The flu is a virus. The Tamiflu is not going to get rid of it. It's going to reduce the symptoms.
Okay, terrific. So now let's switch gears a little bit and talk about the flu shot. Why should we get the flu shot?
Because no matter how effective the flu shot is, and every year it's a little different, one year it's 10%, one year it's 40%, no matter how effective the flu shot is, that 10 or 40% is better than zero.
Okay.
So I encourage everybody to get the flu shot.
And what exactly does it do? Does it just boost your immune system? How does it work?
It puts the antibodies from the flu in your system, so to speak, like the easiest way to say it. It kind of gives your body a taste of the flu, so your body thinks you've already had it and kind of is ready to fight off what it needs to fight off to prevent you from getting a bad case of the flu.
Okay, so if someone gets a flu shot, what should they expect in terms of, some people complain of arm soreness for days, feeling achy a little bit. Is there some things that they should be expecting when they get it?
You can feel a little punky after you get the flu shot. You can be a little tired. You can have very low-grade fevers. You can just have some general body aches. You are not going to get the flu from the flu shot, but you are going to get some mild symptoms sometimes, not all the time. Sometimes people do you get a tetanus shot. You can have a sore arm. It's a shot. It might cause you to have a little discomfort where you got the shot.
Yeah, and you do hear people talk with that myth of, hey, the last time I got the flu shot, I came down with the flu.
Correct.
That's not true, correct?
Correct.
Okay. Karen says, I never got the flu shot. Can someone be immune to influenza?
I guess there's always that possibility if it's the correct strain there's always different strains of the flu, so the flu shot is always kind of mixed to be the strain we're expecting. Okay. So could you be immune to influenza? I guess if you're lucky enough to be immune to the strain that comes out this year.
Right, or you just have a really good immune system, right?
Right.
Taking care of herself, for sure.
Right.
Good job, Karen. John's suggestion is about home remedies. Do any of these work? Are you familiar with anything like that?
So basically, some people they do have some herbs and type things that they use at home. The way I feel about it, again, the flu is a virus. Anything that is going to help you with the symptoms is never going to hurt you. It's just symptom relief. And if it's a home remedy, if it makes you feel better to eat ginger, and it makes you feel better, then eat ginger. It's not going to hurt you. We're really looking for symptom control. We're trying to when someone comes in and sees us, if you do symptom control, that's really all we can do. We can't cure the flu.
Gotcha. And those symptoms again are that high
the fevers, the cough, the achiness, the fatigue, any of that is just difficult.
Let's talk a little bit about who's most at risk for flu, because there are some, age brackets that are definitely more at risk, and we need to be more prevention for them. Can you talk a little bit about those groups?
The elderly population and the young children are the most at risk, or that being said, that are that don't have any previous illnesses. For young children, they're just young. Their bodies are just immature, so to speak. The ones that also have a high risk of, problems with the flu is somebody who has a compromised immune system or chronic illnesses. Their immune system is not going to be as healthy as yours or mine because they're always fighting something off anyway. But we do always worry about the young children and we worry about the elderly population.
And these folks with these conditions are people like diabetics, heart, those types of conditions? Okay.
Correct.
All right, so again, when is the best time to get the flu shot?
You can get the flu shot. Our flu shots came out, I think, in the beginning of October. We're still giving flu shots. There's no end to typically what happens is we run out of flu shots because so many people do decide to get them. We do run out of them. But you can still get flu shots now, and they will be effective.
Okay. And is there ever a time that, I hear people say, well, I put it off, I want to get it later in the season because the flu season extends later. Does that make any sense, or is it smart to just get it?
I think it's just smart to get it.
Okay. All right. We have a question from Amy, and she wants to know your opinion on the new antiviral for flu. And I'm not for sure how you pronounce that word.
We are using Tamiflu. I have not used it, so I can't really speak to that.
Okay. So what's your opinion on Tamiflu again? I know you talked about it earlier, but once again.
I think there's only a risk of nausea, vomiting, diarrhea. It doesn't mean because you take it, everybody's going to get nausea, vomiting, diarrhea. You can get that with it. If somebody comes in and they're within that 72-hour window, I give them the Tamiflu, because if it just helps them feel a little bit better, that's really what we're trying to do.
Okay, all right. If someone is allergic to eggs, can they get the flu shot?
Typically, we don't encourage that.
Okay, now why is that?
There's some interaction between the eggs and having a reaction to the flu shot.
Okay, and some of those reactions
can be severe.
Okay.
Yeah.
Okay. Is there alternatives for folks who are allergic to eggs?
Not that I'm aware of.
Okay. All right.
That I'm aware of.
Can I get vaccinated and still get the flu? We've talked about that, but maybe you can talk a little more, just reiterate.
Yes, you can get a flu shot, and you can get the flu, because, again, the flu shot is a guess of what strain the flu is going to be this year. It's not dead on. So sometimes people will still get the flu, even after a flu shot.
Yeah, and are you hearing that this year's vaccine seems to be a decent match? Usually you hear reports in the news about whether it's going to be a match this year or not.
I haven't heard a lot of mumbo jumbo that it's not going to be, so it sounds like it's probably going to be a good match.
Okay, terrific. We want to encourage our folks at home, our viewers at home who are watching us tonight. We're talking about the flu shot, flu prevention. We're here with Phyllis Tedeschi, who's a nurse practitioner at Health Express, part of South Shore Health. Please send in your questions, folks. Tracy wants to know, do remedies such as Airborne really work to hold off the flu? I've actually taken Airborne, and I feel it does work.
I think that there is a benefit to some of those type remedies. However, nothing's 100%. So you might have been lucky. Maybe people take it a lot when they fly. I know that, and they feel like it does work for them when they fly, that they don't come down with some of the things like on airplanes. I don't know if it's going to actually hold off the flu. Would you have gotten the flu if you didn't take it, or would you not? That's a hard answer.
Okay. Can the flu vaccine provide protection even if the flu vaccine is not a good match? Does it provide a little bit?
It probably will provide some protection. You may still get some strain of the flu, probably not as bad as you would get it if you didn't have any flu vaccine.
Okay, and just to clarify again, the flu vaccine does not prevent the flu. It actually helps alleviate symptoms, correct?
Correct.
Okay. All right, Phil wants to know, whatever happened to flu mist through the nose?
I do think some people still use the flu mist. We don't. We use the flu shot. But I do believe that there are still places that you can get the flu mist.
Okay. And why was it that flu mist for, you guys don't use it, so is there a particular reason why?
No, not that I know of. I just know that we always just do the flu injections.
Okay.
Yeah.
My kids used it years ago, and I know it had been taken off. Just was curious. James says, I have the flu. What should my next steps be? Yeah. What happens when you get the flu?
So we're going to talk about the symptom relief again. You're going to use your Tylenol, your ibuprofen to help reduce fevers, sleep. You're going to eat healthy. You're going to wash your hands. You're going to cover your mouth when you cough or sneeze. You're going to stay home until all your symptoms have resolved. And I have to add to this, when this whole fist bump thing first came out, I thought it was a very masculine type way of, hey, how you doing, kind of thing. Now I think the fist bump is the best thing that ever came out, because you're not shaking hands with somebody whose hands might be a little dirty. So that whole fist bump thing, I like it.
Awesome. I never thought about that.
Yeah, I like that now.
Very cool. Lisa wants to know, how can you shorten the length of flu symptoms?
You can't. all you can do is give yourself some symptom relief. The flu is a virus. A virus has a mind of its own. It's going to stay for the 5 to 7 days. You can't get rid of it in 3 days unless you're really lucky. And if you figure that out, Lisa, please let us know, because I will tell everybody.
You do need to get that flu vaccine every year, right? I mean, it's not a one and done, last me a couple years type thing.
Yearly. It's a yearly vaccine.
Okay.
Yeah.
All right. And this is a great question. How do you protect your loved ones from flu this season?
Again, it's that hand washing. It's not, if you have little children at home and you have the flu, or you have elderly people with you, living with you at home, buy a mask. Wear a mask around your house. You're just trying to prevent the airborne little droplets going around the house that everybody else is going to be inhaling, and that's just that good cleaning the countertop surfaces well, good hand washing, and stay away from them.
Okay.
Don't pick up that little baby and start slobbering all over its face and kissing it and telling it how cute it is when you have the flu.
Yeah.
You're just going to pass it on.
Yeah. Actually, that leads me to my next question. How do you protect our youngest children who can't get the flu shot? Moms at home who have babies and they're worried. Like, how do you protect a child who hasn't been vaccinated?
You don't bring them around other people that have the illness or any type of illness. If they don't need to go to the supermarket with you, if they don't need to be, in the public places, just try not to. I know sometimes there's no options. You have to take your kids to the supermarket. I always had to take mine. But it's just, wash those carts down in the supermarket. Just try to think germs are everywhere. And it's those germs and, the people coming over and pinching their cheeks and being in their face. You don't want that. You're trying to just keep everybody healthy.
So same would go for grandparents and caregivers who are taking care of their grandchildren. They should potentially be looking
Correct.
into getting the flu shot too,
Correct.
right?
Yes.
Now, there are some elderly, can the elderly get the flu shot, or beyond a certain age is it encouraged not to?
No, they can get the flu shot. There is a different one, I believe, for over 65. We do not offer that at, I think most places don't offer that. I think that's one you have to get at the pharmacy.
Okay. We do have a question from Tara, and she wants to know, how can you take precautions when traveling on an airplane?
So Tara, I have the perfect answer for this because I travel a lot. You're going to take those wipes with you on the airplane, and before you sit down in your seat, you're going to wash your entire seat down. You're going to wash the seat belt, you're going to wash the armrests, you're going to wash the little table, you're going to wash the windowsill of the window, because anything on that is going to go right onto you while you're traveling. If you do that every time you travel, your risk of catching something on the plane, we can't help what goes through the air system unless you want to wear a mask on the plane. But as far as the seats and the tables and all of that, you can totally clean that up before you sit down. Seatbelts, headrests, everything, wash them with a wipe.
I really hope my mom is watching right now, because we went on vacation, and the first thing she did when we went into the hotel room was exactly that. She pulled out Clorox wipes and she wiped down the light switches and all of that. And she's an ED nurse, so she probably learned a thing or two. So, all right. Elliot wants to know, what if you're 70 years old and you've never had the flu shot or the flu?
You're so lucky. You've just dodged it. There's no real answer for that. I mean, you're lucky you haven't had it, and good for you. Doesn't mean you won't get it. There's just always that risk.
All right. This question came up in my office today. What is the difference between the stomach flu and the flu?
So the stomach flu is the gastrointestinal nausea, vomiting, diarrhea. That is another virus. There is no medicine that's going to make it better. Again, it's a good hand washing and staying away from somebody that's had it, because that just seems to get passed around by touching anything. But typically with that, there are no high fevers. There are no difficulty breathing. There are no coughs. That's 24 to 48 hours. It comes and it goes, and you don't feel so well going through it, but it's gone in 24 hours, typically 48 maybe.
Okay.
Linger.
Okay. What are some other ways that we can fight back against the flu?
Well, again, it's just good sleep, eating properly, exercising, keeping yourself healthy, keeping your immune system healthy. Don't do the things that are going to, smokers decrease their immune system by smoking. Drinkers decrease their immune system. So, I mean, all the things that are going to kind of work against your health are going to decrease your immune system. So it's good eating, it's good sleeping, it's hand washing, it's, vitamins and that type of thing.
Okay. We want to encourage our viewers at home to send in any of their questions. We are talking with Phyllis Tedeschi. She's a nurse practitioner at Health Express, part of South Shore Health. We're talking flu today, folks. So if you have any questions, please send them in and we're going to try to get them answered for you. Carol wants to know, do you recommend getting the flu shot and the pneumonia vaccine at the same time, or should you wait and get them separately? And if so, how long in between? That's a big one.
I would probably suggest getting them separately, only because I think sometimes you can feel a little, like I said, a little punky after you get the flu shot. You're going to get that. Sometimes you can get that fever, the fatigue. You may also get that after the pneumonia shot. And any time you get a type of vaccine, you run the risk of getting that. I would like to think that it would be best to do it separately and probably a couple weeks in between, just to make sure that you're not really knocking yourself down.
Okay, all right. And Nancy would like to know, can you get the flu shot if you're taking prednisone?
Yes. I don't see any reason that you couldn't.
Okay, all right. Let's talk a little bit about pregnant women who may be at risk for the flu. If someone who's pregnant feels that they've either been exposed or they're feeling like they're having some of those symptoms, how quickly should they go to their PCP and say, I'm worried? I mean, pretty quickly, or should they wait until they have symptoms?
Well, there's not going to be, even if you go to your PCP right away, if you've been exposed and you're going to get it, running to your PCP is not going to stop that exposure. Mm-hmm. You can't prevent it. But I definitely think that I would put a phone call into my PCP or my OBGYN and just let them know that this is how I was exposed, and what should I look for? What concerns do I need to worry about being pregnant? Is there anything that I need to see you for? And I would have that conversation with my OBGYN.
Okay. Is Tamiflu used as a proactive approach to, curbing those symptoms right away or not?
Again, if you get Tamiflu within the first 72 hours of the symptoms, it tends to help relieve some of the symptoms, make them a little less. You may not get rid of them. It just might make them more tolerable.
Okay, all right. So Elliot has written in and he wants to know, how can you protect yourself in a crowded subway? I mean, we're around people all the time. What can we do?
Elliot, unfortunately, it's probably wearing one of those masks and not touching anything. It's hard. I mean, when you're around that many people, somebody's always sick with something. People are going to sneeze. No matter how they try and cover their cough or their face when they sneeze, you're in a crowded subway. All you can do is the best you can do. Get off the subway, wash your hands. I don't know what else to tell you on that, except just be aware that you're around that many people.
We talk about, cough and covering your mouth when you sneeze. There is the proper way to do that, right? I mean, we shouldn't be coughing into our hands, right?
Always into your elbow. And it makes me crazy when I see someone out to dinner and they cough or sneeze and it goes into their hand and then they start eating. I'm like, oh, it's just, it always into the elbow. And that way there you're not getting it on your hands, which is what you're touching everything with. You're touching everything with your hands.
Okay. Do you know the radius as to how far those germs spread? Have you read anything about that?
I want to say it's 6 feet.
Okay, so quite
a 6 feet.
Wow, interesting. Amy wants to know, what about Fluzone? Or is that how you would say it, I would suppose? I hear this is a high-dose injection for the elderly. Are you familiar with that?
We don't actually do the elderly injections. Again, I think that is done at the pharmacy. I don't even think their primary cares do that. I think that's done through the pharmacy, so I don't have a lot of information on that.
Okay. All right. And Michael wants to know, does single malt scotch work? What do you think?
Michael, I think I would be trying that right away, because what's the worst that can happen? You'll feel a little better anyway.
We have just a few minutes left, Phyllis, but I kind of want to do a lightning round with you as a recap, if that's okay. So let's talk again. What are the months that we can expect flu?
October to February, March-ish.
Okay. And should we get our flu shot, and why?
Yes, because no matter how effective it is, whether it's 10%, 40%, 60%, that is more effective than not getting it at all.
Okay. And symptoms, again, what are some things that we should be looking for?
High fevers, fatigue, total body aches, loss of appetite, cough, just I don't feel good from head to toe.
Okay. And again, the difference between that and a common cold?
Common cold, we typically do not get those high fevers. We do not get the fatigue. We do not lose our appetite. People may lose their appetite because they get congested and they can't taste their food, but they typically don't lose their appetite. And we don't get shortness of breath. We don't get the cough, the pneumonia symptoms that we worry about.
Okay. And then again, how do we protect our loved ones?
Face masks, good hand washing. Do not be going in their faces, kissing them. Covering your face when you cough and sneeze. Again, into the elbow, not the hands, and then go over and go, oh, hi, Graham, how are you? And rub their face. It's not going to work.
Okay. And big question of the night, too. ED versus urgent care for this? What do you think?
There's no reason to go to the emergency room unless you have severe difficulty breathing, chest pain, really, really, really sick, or you're immunocompromised where there's a possibility that they'll maintain you overnight and watch you. But for most people, they can go to an urgent care center. We do chest x-rays. We can check to make sure it's not a pneumonia. We can prescribe Tamiflu if it's in the window of Tamiflu. We can give fluids if somebody needs to have a liter of fluid just to kind of bump them up a little bit. We can do all that in the urgent care center. They do not need to expose others in the emergency room or be exposed to other things while they're there.
Okay. If you had one thing to tell patients today about flu and prevention, what would it be?
Stay home until your symptoms are completely resolved.
Okay. Which is usually between 5 and 7 days,
5 and
right?
7 days, yeah.
All right. Terrific. Phyllis, I want to thank you so much for joining us tonight.
Thank you.
This was very informative. We want to encourage everyone out there, again, go get that flu shot. The flu season is here. If you missed tonight's segment, you can watch us on our Facebook Live page, Also, tune in to onehealthyboston.com. It will be there. We want to thank you for joining us, and thank you to all our viewers who sent in questions. Thanks,
Thank you.
Phyllis.